I'm Dr. George Anterasian. Today we're going to be doing a Botox and Juvederm procedure on Sara. Sara is a lady in her early 50s with several concerns on her face. So let's take a look. If we look at Sara's face, we can see first in the forehead area fine lines which concern her. Raise your eyebrows, Sara, which can easily be seen when she raises her eyebrows. In addition, if we look at her eyes, we can see on the side here the crow's feet lines, which when she smiles become much more prominent. So we're going to be doing a procedure with Botox today to treat the crow's feet lines and to treat the forehead area. Botox works by relaxing the muscles. Following treatment with Botox, I would expect those lines to be softened and more relaxed. The goal of Botox is not to paralyze the face. The goal of Botox is to give a nice, relaxed look. Following the treatment with Botox, we will go onto the lower part of the face and treat her nasolabial folds and her melolabial folds with Juvederm. Juvederm is chemically a substance called hyaluronic acid. Every human being has hyaluronic acid in their skin. However, with the natural aging process, hyaluronic acid is lost from the skin, and as a result, the skin loses its turgor and it becomes more lax. So when we do a treatment with Juvederm, what we are doing is simply replacing the natural substance that is lost with the passage of time. So following the Juvederm treatment, we would expect to see the cheek tissues more elevated, the nasolabial fold softened, and the melolabial fold softened, and a more youthful appearance. I'm going to start by planning out the Botox procedure. Turn that way. Putting a mark on the skin at every point where I want to put in the Botox. So I've finished marking Sara for her Botox. Let's take a look at the injection points. So the injection points on the side of the eye, this will relax the lines that form in this area. It'll relax those lines and soften those crow's feet lines. The injection just above her eyebrow here will help to elevate the eyebrow just a little bit, which is a very nice look. The injections across her forehead will soften all of the fine lines and relax the forehead muscles. And then the injections between the eyebrows will relax this area as well. In addition, Sara is bothered by dimpling in her chin area. I have marked out 2 injection sites for Botox to soften the dimpling in the chin. Okay, we're going to begin. So I finished the crow's feet and eyebrow injection on Sara's left, and she tolerated that very well. Sara is not numbed for this Botox treatment. Most patients can do Botox without numbing. Occasionally a patient will like to numb, but most patients will do it without numbing. The needle is extremely small, very fine, and goes in very easily, with patients hardly feeling the injections at all. The same thing on the right. Okay, I'm going to go on now to the forehead. And that completes the treatment of the forehead with the Botox. And we'll finish up the upper third of her face with the treatment between the eyebrows. Chin up. Okay. And that finishes the Botox treatment in the upper part of the face. So we'll finish Sara's Botox by treating the dimpling in her chin with just a little Botox in this area. And that's it. Sara, how did it feel?
It was very comfortable, not painful, and you're very gentle, which makes it very easy.
Okay. So, thank you. Amanda will come in. She'll get you all cleaned up, and then we'll numb you for your Juvederm. Okay?
Thank you. Thank you.
We're going to use Juvederm to act as a filler to soften the nasolabial fold and the melolabial folds. So we'll do a series of punctures to place the Juvederm. Here we go. You doing okay, Sara?
I'm fine, thank you.
We're going to inject now the melolabial fold. Open slightly. Okay. I finished the treatment on the left side of the face. The right side I have not yet treated. It's very easy to see the difference the Juvederm has made. The left nasolabial fold is much softer than the right nasolabial fold. The left melolabial fold is much softer than the right melolabial fold. And this entire cheek complex has been elevated and moved up into a more youthful position, giving a very nice rejuvenation to this part of her face. There's a large difference between the left side and the right side, and that difference is visible not only when Sara is at rest, but also when she smiles, as you can see. So I'm going to start now on Sara's right side. How are you doing, Sara?
I'm doing fine, thank you.
Okay, chin up a little bit. Mm-hmm. You comfortable?
I am.
Okay. Okay, open again. Okay. So I finished the Juvederm treatment on Sara's right side. I've put the Juvederm into the right nasolabial fold, into the right melolabial fold, and those folds are now much softer, and as you can see, matches quite well her left. The right cheek has also come up into a more youthful position, and in general the face has a very refreshed, natural look. What I'm going to do next is to address these etched-in lines here. These are very thin in the skin, just slightly underneath the skin surface. Okay, so I'm going to inject now Cosmoderm. Cosmoderm is a collagen-based product, and it's unique in that it is the dermal filler that can be placed most thinly underneath the skin. We're going to use the Cosmoderm now to treat the very fine etched-in lines in Sara's skin. So we'll start here. Chin up. Chin up a little. Open slightly. Give it a massage so that everything is smooth. So we're all done. Again, we put the Juvederm in the nasolabial fold and melolabial fold to soften those folds and to elevate the cheek complex into a more youthful orientation. In addition, we followed that up with Cosmoderm to treat the very fine etched-in lines. We've completed that on both sides, and as you can see, the result is a very natural appearing, but also very youthful appearing face.
Wow. I look like I did 20 years ago. Wow, beautiful. Thank you. Really? Wow. God, it's gone. Everything is gone. Huh. Wow. Not painful at all. You're very gentle. Amazing.
Mm-hmm.
It's very amazing. Wonderful. Loved it. Recommended. I feel wonderful. It wasn't as difficult as I thought it would be, and the end result is amazing. I'm so excited. I wasn't numb for Botox, and honestly, it was minimal pain. It was like a pinch, so it wasn't bad at all. I thought it would be painful, and it wasn't. For Juvederm, I was numbed a little bit, and again, it was tolerable, not as painful as I thought that it would be, and the result is amazing. I was numbed with a numbing cream for about 15 minutes, and the pain was, again, minimal and tolerable. It was more painful than the Botox, but again, it was tolerable. It is a very natural looking result in my eyes. I like that I look like I did 20 years ago, and I feel fresh and youthful, and I love it. And I would recommend it to all my friends and everyone who wants to look youthful and young, and the result is amazing. It's been 2 weeks since my Juvederm and Botox procedure, and I have a birthday coming up. I'm going to be 55 years old, so it was perfect timing. And looking at the before and after pictures, I look at least 12 years younger, and looking at other pictures, I remember I was in my 30s and I almost look the same. So it's to me it looks very natural. It doesn't look fake. I'm glad I had it done. It was painless, and I would recommend it to everyone, to all my friends. I love it, and I'm glad that I had it done.